Phobic disorders is the topic for this video. And phobic disorders are really, there's quite a few, but we're going to concentrate really on two types. There's general, and then there's specific. And as the name implies, phobic disorders are basically any kind of disorder in which the presentation involves intense fear of a situation, object, or thing. Now, the general ones that we're going to talk about are agoraphobia and social phobia. Those are the general ones. And the specific ones, well, the list is so long that I'll just point you to a website. It's called phobialist.com, and you'd be surprised. There's probably hundreds and hundreds of specific phobias. And what you really mean by specific phobias is when the person is afraid of one particular thing. So, for example, if the person is afraid of spiders, they would have arachnophobia. If the person is afraid of water, hydrophobia, and it just goes on. And this list, the website lists hundreds and hundreds of specific phobias. The general ones, which are more commonly tested on licensing exams, are agoraphobia and social phobia, and we'll talk about these in this video. So first, let's talk about agoraphobia. Agoraphobia, and all these words actually come from Greek. Phobia is a fear, and the first part of the word always comes from the Greek language. Now, agoraphobia is basically fear of public places, public open places. Now, for example, a supermarket or a concert, places where there's a lot of people. It could be, a line at the bank. It could be a bus, public transportation, a bus, a subway. And the reason people have a fear of these open spaces is because, and this is the key point, is that the fear involves that they may not be able to escape from these places. Places in which places that are difficult to escape if required. So that creates a tremendous level of anxiety and fear. Agoraphobia can also, of course, lead to panic attacks, and as a result, the patient can become homebound or housebound because they're just afraid to go out. They're afraid of public open spaces. So this is a pretty significant disorder that is commonly tested. The next type of phobic disorder that's characterized as general is social phobia. Social phobia is basically when the person has intense fear of social situations, getting together with friends or social gatherings, and also performances. So, for example, public speaking. Public speaking is by far the most common. There's actually a study done about public speaking that states that public speaking is the #1 fear of a human being. On this list of top things that people are afraid of, public speaking was #1. The #2 biggest fear of a human being is death. So people are more afraid to get up in front of a crowd and give a speech than they are of dying, according to a study that was done. But social phobia is very, very common, and as a result, when a person is in a position to do public speaking, or maybe acting in a play or playing a musical instrument in front of people, they will have these symptoms of sweating and trembling and all the things that you would expect if a person is incredibly nervous or afraid. So that's social phobia. So now that you have the definition and the description, how do you go about it? Well, the diagnosis, these are psychiatric disorders, so the diagnosis really just involves a history. In a history, there's no diagnostic testing. Just talk to interview the patient, and you get a history and characterize them in a category of phobias. But the treatment is really what we can get into. Now, there's of course, like all psychiatric disorders, the treatment usually is two-part. The first is medications, and the second part is therapy. Now, the medications for both agoraphobia and social phobia involve medications that can be used to calm the patient down, reduce their heart rate. And the most commonly used ones are benzodiazepines. For example, lorazepam. Lorazepam is given and it calms people down and helps them. It's short term. Another medication that's given are beta blockers, and beta blockers are given to reduce a patient's heart rate so that they can perform or get up on stage or whatever they need to do. And one of the more common ones is propranolol. There's many beta blockers, but this is a more common one. Now, therapy. What type of therapy? Well, there's two types. There's exposure therapy, and then there's cognitive behavior therapy. Exposure therapy, as the name implies, refers to simply exposing the person to the thing that they are afraid of. And at first that may sound ridiculous, but it's shown that if this is done in a controlled environment, that the person can eventually habituate to the thing that they're so fearful of, and then gradually their anxiety will decline as this is practiced. The second one, which is cognitive behavior therapy, involves sitting down and teaching the patient to recognize and control the way they think and their beliefs with regard to what they are afraid of. And the combination usually works very well. It's actually worked, it's shown to work in greater than 90% of cases. So I'd like to finish off with a couple of vignettes. So the first one, a 30-year-old man presents to his primary care physician stating that he feels very lonely and would very much like to have a close circle of friends. However, he feels very anxious in social situations and avoids social invitations from acquaintances at work. He states he would like to be more interactive in social events, but he worries that other people will notice his inadequacies and talk about his problems. Which of the following is the most likely diagnosis? Well, this is social phobia. Let me explain why it's social phobia. Social phobia is characterized by fear and avoidance of social situations. So this young man, he's only 30, he feels very anxious and avoids. So, for example, people at work are inviting him out and he's saying, no, I don't want to go. He wants to go. Did you notice that in the clinical vignette? He would very much like to have a close circle of friends. So that's a very important point, that the desire for social contact and interaction is there, but their fear of social situations and a feel of embarrassment and inadequacy is so great that it leads them to be avoidant because they feel that they might be embarrassed or humiliated, and that's talked about in the latter part of the vignette, that he worries that other people will notice his inadequacies and talk about his problems. So that is social phobia. All right, now let's go on to the next one. A 20-year-old woman drops out of college. She explains that, all of these are she's, is so afraid of having a panic attack that no longer willing to sit in class because would not be able to leave. The same fear also has led to stop going to shopping or movies because of being afraid of having a panic attack in the ticket line or theater. Which of the following diagnoses is most likely? There's fear of having panic attacks sitting in class, because they may not be able to leave or escape. You remember that? Same fear is that the patient is not going shopping or to the movies, so fear of public places, afraid of having panic attacks in a ticket line or theater. So this is a vignette that describes somebody who is afraid of public places, fear of essentially going out, and in particular, and the vignette even says so, places that it might be difficult to escape, and that is classic of agoraphobia. So that would be choice A.